Welcome, everyone. This is the Buttercup podcast where we talk about early childhood topics. I'm so excited today. I have a special guest from Norway who's joining us on the Buttercup podcast. Oh, and my name's Marisa Macy, and I'm the host of the Buttercup podcast. Today, I'm so excited because I have a special guest from Norway. Today, I have joining me Dr. Kine Melfald Tveten, and she is a pediatric physical therapist from Norway with 13 years of clinical experience in developmental neurology and movement disorders. She earned her Ph.D. in infant motor function assessment and is currently a postdoctoral researcher with the transdisciplinary MoveEarly project in Bergen, Norway. Dr. Kine's research focuses on movement, play, and exploration in early childhood. She's driven by her passion for promoting the joy of movement. Dr. Kine is also an advanced practitioner within Sherborne Developmental Movement and loves to have interactive and creative presentations. And that's how I got to know you through your presentation. So welcome, Dr. Kine.
Thank you very much, Marisa. Thank you for inviting me.
Oh, thank you. And so, how did you get started in this field of early childhood education and physical therapy and movement and play?
Yeah, well, it was kind of a coincidence that I went into early childhood field because as a physiotherapy student, I didn't think that early childhood was my field. I felt I was not very good with children, and I found it hard to work with them and communicate with them. But in 2012, I started in a clinical practice in Bergen, here in Norway, where most of my patients were like from the age 0 to 12. And I had a great mentor. I still have her as a mentor. And I got so many positive experience of working with children. And also becoming a mother myself really opened my eyes for these like amazing years of early childhood where there's so much development going on. So it's a really crucial period. And I think that as researchers and professionals, we have the possibility to make a huge impact on children's lives. So I think I'm kind of grateful, and I think we should act carefully and deliberately when working with children. So yeah, that was about how I started. And yeah, so then I did started my PhD working with infant motor development, assessed a lot of infants, and then I went into the postdoctoral work where I work in more of the preschool age. So yeah, but it's all mostly about movements, assessment of movements, and yeah, children from 0 to 6 mostly. Yeah.
Very cool. Thank you. And um, when I got to um, see you present at the Bright Start conference in London last fall, you talked a lot about functional movement in early years and also play-based assessment. And one of the things that you did in our presentation was an imagery activity with us. Would you like to share that?
Yeah, yeah, I can share. I would like to say that like in general, I'm a visual learner myself. So I like um, to use like pictures and metaphors when I'm presenting something or explaining something. And I also believe that it's important to use all our senses as a pedagogical principle, because I believe that that will lead to more of a deeper learning. So, in the from the example of the Bright Start conference, I wanted to just give a picture of how important I think play is. And So I really wanted the audience to kind of embody the importance of play. So I invited them, and I think I will also do it now. So for those who are listening, I invite you to close your eyes and think of a memory when you were playing. And think of, were you alone or were you playing with someone? What did you do? Did you hear any, like, what were the sounds around you? What were you playing with? What's the atmosphere? And how did you feel while playing? And thinking about that, how does it make you feel now? And then open your eyes again, and then you hear the statement, they are just playing. It's not important. And that is a statement we hear from time to time, and I think it's really awful, because then you see play as a very important thing, but it's so crucial for us to play. So yeah, that was some like a little experiment I did during my presentation.
Yes, that is so awesome. So I was closing my eyes and thinking about last weekend. We had a long weekend, and I took my daughter to see my parents. And uh, I asked my daughter, "What do you want to do with them when we see them?" And she said, "I want to play hide and seek." And so we played hide and seek, all of us together. And there was so much giggling and hiding and excitement when the person was found. And and I was thinking about, the domain that you study, gross motor, and a conventional test can give you some information, and we can look at norms and see how a child performs against the norm. But when we play, we learn so many more things about them. And so, like, if I was just watching me and my daughter, my parents playing, we got to see the people like hide in little places in the closet and then stand up and roll over and like all these different things, and using movement and play in ways that maybe a traditional test might not give us.
Yeah, yeah, exactly. And also that is one of the things I'm working on with the research I'm doing now. We are using a new test of trying to capture movement competence and creativity, and it's done through storytelling. Um, and that's very different from our traditional tests we use, at least in physiotherapy, where it's very like instructional, like, can you jump? Can you skip? Can you hop? Can you throw? Whatever. But in this new test, which is called the River Challenge, we're more of inviting the children to come and play with us in this storytelling. Um, and I think then you really get the children to show themselves what they can from a gross motor perspective, but also since we have some creative items and some more open-ended tasks, we get to see or get a little glimpse of how they are thinking, what are uh, their creativity. We are trying to capture creativity. I'm not sure, because I mean, what is creativity? It can be so many things. But for instance, one of the items is, because in this story, the children are invited to help some frogs crossing a river, and instead of stepping on these river stones when they are washed away by the rain, uh, they have like three options. How will you get the frog over? And some of them will just carry them like they did when in the previous test items, but some will really show some great ideas, like yeah, they can sit on the frog I have to tell you, it's a Pilates ball. It's a really big gym ball. So they can either sit on it or they will slide on it. Or as one child told me, yeah, now you get on the ground because you are the bridge and I will step over you. So he actually stepped over me with carrying this frog. I think it's so great. And it really made me think that some children will kind of fall in the traditional tests. They will not kind of shine in these tests because um, yeah. But when we are capturing this creativity part, they really get the chance to shine, and I think that's great. Yeah.
Yes. Oh my gosh. I love that so much. And you showed us in the presentation what it looks like, the river challenge and
Yeah.
video clips, and it's so cool. And I teach assessment class, and one of the things we talk about is authentic assessment and ways to assess children that are uh, capturing what they can do. And I think sometimes um uh, we think about assessments and being able to capture all the different ways that they can show us. And when they're having fun and when they're playing, you get to see the little aha moments and sparks go off in their thinking and creativity, like you were saying, and also the skills that you're looking for. So you go in, it's an authentic assessment, but and you know what you're looking for, but it's playful, it's joyful, they're having fun, and you're using materials and the familiar environment so the child feels safe and comfortable and I love that. So like if we're looking at how they step, it's not the steps that go to nowhere in a clinic with unfamiliar materials, and the child might have steps in their house, but if we test them in a clinic with steps that are not real steps, but like little boards set up that are not real steps, they know the difference. And
Yeah.
but when they're like hopping on the rocks to get across the river, we can see those same kinds of skills, but in a way that's maybe capturing what they can do. And that's really, really neat how you do that.
Yeah. Thank you.
Yeah. Well, and one of the things that you showed us is the kindergartens in Norway. And you
Yeah.
had four pictures. One was where your children go to school, and then the outdoor classroom. And uh, um, one of the things that I thought was so exciting was it looks like it's cold. I've never been to Norway. Someday I
Mm.
hope to go, but it looks a lot like it does here in Wyoming in the winter. Lots of snow, ice, but children in kindergarten still are outside in the outdoor classroom. And you want to talk a little bit about nature and the role it plays in early childhood
Yeah.
education?
Yeah. Well, I think so. I think that it is like uh, being outdoors, traditions for being outdoors, that is a kind of inherent in the Norwegian people, in most inherent people. It's for most Norwegians. Uh, and I think that is something we also see in the preschools or early education settings. Uh, and I think it's also part of like the Nordic tradition for early childhood education. Of course, now I'm a physiotherapist. I'm not early education teacher, and I'm not in the program for early education teaching. But yeah, as a physio, I've been to quite many preschools myself, and of course, my I have two daughters in preschool, so I have some experience. But it's yeah, we spend a lot of time outdoors and we believe it's not so much focus on like the learning, but it's more of the whole holistic experience. And like as an example, I can tell you that for my daughters, the preschool they go to, they have like hiking trips several times a day, and they also have for all children before they start school, they have to go up to one of the mountains we have surrounding Bergen, the city of Bergen. And that's quite a long trip for a 5-year-old, but everyone does. So once before they start school, they have to go up in that mountain. So yeah, they spend time outdoors several times a week. They go on hiking trips, and then they bring food. They prepare and cook the meals, have the meals outside. Um, so then the children also have to carry a piece of wood in their little backpack to make a fire. They collect materials uh, out in the nature, and they have like creativity, like art projects afterwards. Um, so I think they get really many experiences. And also, like from a physiotherapy perspective, I think that being out in the nature, being outdoors, gives so many various experience. So because the environment is changing all the time, just imagine going into the woods in spring with all when trees and flowers are blooming and all the nice, like the smell from the flowers, everything. And then in the autumn is a totally different experience because then the leaves are falling and you have totally different colors. Then in the winter you have the snow. So it's changing all the time, gives so much variation. Um, and also like a sensory experience of walking in heavy snow. That's quite hard. Walking in heavy snow or sand or like up hills, walking on ice, then you really have to adapt your movements and your strategies um, to kind of like even walking, running, whatever. So it gives so many experiences. And also, I think I can imagine. I can hear that I get really excited talking about this because I think it's so important. But no, as physiotherapist, I work a lot of like hands-on. So I acknowledge the like all the sensory inputs working with with my hands. And I'm thinking for children, if you play outdoors, imagine the difference of like working with wet sand or how heavy that can be, or if you have a dry sand that will just gently run through your fingers or the experience of mixing water and soil to like what is the right amount of water and soil to make the perfect mud cake. That's also important experience. Um, and yeah, I think, and also, for instance, just being outdoors with different types of weather. If you're walking when it's like stormy winds, that's a totally different experience than on a sunny day. So yeah, I think it's really valuable, and I really appreciate that children get to spend a lot of time outdoors. Um, I wish we could see more of the same in schools. I know some schools have some of their classes outdoors. I think that's great. I think that will be very beneficial both for learning, but for like the overall well-being. So, but of course, not everyone has the possibility, not the facilities to be out in nature. But yeah, so that
That's
was a bit about
yeah,
that. Yeah.
yes. I love what you were saying about functional movement looks different under different conditions. On a sunny
Yeah.
day, it is going to be different to walk to the mailbox compared to on a day where there's gusts of wind and rain coming down. Uh, that's great. So I was wondering if you could talk a little bit about what service delivery looks like in Norway. So, so you would assess a child and um, and learn about their abilities and their skills from the assessment. And then what happens next?
So were you thinking from like a clinical setting, in
It could be,
physiotherapy setting, or
yeah, however, however it looks in your practice.
yeah? Um, so where I work, it's a very specialized practice where families come from the whole country for intensive rehabilitation. So that's for children with typically um, uh, neurodevelopmental conditions. Um, but sometimes I've also been working with more in the like local community. I can get a child referred because there could be the staff in the preschool, there could be staff at school, or the parents, or a general practitioner that is concerned about their motor development. So yeah, we will have a consultation with the child and the family. Um, I've been doing a lot of standardized assessments, and that's a whole discussion in itself, the use of standardized assessments. But yeah, that is what I would typically do. Sometimes I also have the opportunity to go out to the child's preschool or school, or um, to also look at how we can work on promoting um, the skills that is needed. Yeah. Um, it's in Norway. You get like direct access to physiotherapy, so you don't need like a referral from a general practitioner. Um, and we try to have some collaboration between the preschools uh, and physiotherapy service. Yeah, um, and it's a free of charge service for children. Yeah. Um, yeah, it very depends on like what is the concern, and yeah, sometimes we will just kind of have more of a surveillance of the children's development, but sometimes it will be needed with more of intervention. Yeah, we have a public health care program for children from 0 to 5. Like in the municipalities, they have these well baby and child clinics, and they are followed, but that's mostly by public health nurses. But sometimes also physiotherapists are involved. Yeah, but they have like regular visits. But it's mostly on like checking up on growth, but they also do some assessments of motor development and social development and social skills. Yeah.
That's great. It sounds somewhat similar to how we do it in America, where there's developmental screening, where we can get a snapshot of how a child's doing, and you use the word surveillance, and a developmental surveillance system would mean a child may not be um, in a service system yet, but we're kind of keeping an eye on them, kind of
Yeah.
tracking their development. And
Yeah.
so maybe we use developmental screening tools at regular intervals to just kind of um, check how they're doing, because maybe they're they're developing and growing, but they're for some reason we want to keep track of how they're doing. So we monitor, and we use developmental surveillance to kind of just keep an eye on things. Um, and then if the concerns escalate or if things change, then we might give a more comprehensive evaluation, where we might give a standardized norm referenced assessment, or different assessments to try to learn more about how the child's doing. And those types of assessments would help us determine eligibility. Do they need more specialized services in an area or multiple areas of their development? So maybe it's motor, maybe it's fine motor skills, or gross motor skills, or cognitive, or adaptive. Um, it sounds pretty similar to how we do it here. And then if a child does need services, then each child has an individualized program here in the United States, depending on
Yeah.
what they need. And so the team has maybe a service coordinator or someone who's kind of the hub of the team, and they bring everybody together with the family and the professionals who will be serving the family and develop goals for the child. And maybe the family is also part of the goal development process. Um, Here in America, we have an individualized family service plan for infants and toddlers, and that could also include and would include the family as well. And so maybe the family wants to learn more about the child's development. That could be part of the plan, or maybe respite could be part of the plan, or classes for the family, or ways to support the parents and the family, and also the child as well. So yeah, it's so fun to talk to you and learn more about how the Norwegian model looks and compare and contrast to United States, and how we are similar and how it might look different in Norway with children
Yes.
and the public health
It's,
nurses. That was really
yeah,
interesting.
yeah, I think that's it's very yeah, I think it's yeah, uh it's a good way of keeping it like a low threshold um uh for also for the parents to ask questions and not make like the public health nurses. You don't feel like it doesn't need to be like a big concern, but you can talk to the public health nurses. They have time for you, and also that you don't have to pay. I think that's also important. Yeah.
Thank you. So, Dr. Kina, in your field of physical therapy or physiotherapy, are there any innovations or practices that excite you today?
Um, well, I think when it comes to assessments, I think that we are seeing a bit of like a shift from the standardized assessments where you look at motor milestones, like slyly on the motor milestones, when you're now looking more into like qualitative aspects of movements. I think that's really interesting because it puts also a bit of a pressure on us as observers. Like really need to be trained to observe children in their movements, in their spontaneous movements. What are they showing us, and not only can they uh, can they walk or can they not walk, can they crawl, can they not crawl, but how are they doing the things they are doing, and how can we help them uh, if they need uh, to give them also kind of a more a varied motor repertoire. um, so a shift from looking solely on motor milestones to qualitative aspects of movement. I think that's important. Um, there is a huge focus on like functional training, and also like you mentioned goal assessments. Like what is it that we should work on? I think uh, I often say that when I work with a patient or a family, it's like yeah, I can or might be an expert in the field of physiotherapy and development, but you are the expert on you because you know yourself and you know what you need, and in your life situation, in your context, in your family context, what is important for you um, to do or to like, yeah. So when we spend a lot of time on settling goals for an intervention, I think that's really important. And here the voice of the child um, is getting more attention now than used to when I started, when I went into pediatric physical therapy. I think that's important, but it's really also it's challenging because sometimes to help the children to really set their goals, to tell us what is important for me, because sometimes they don't know also what is possible for them to achieve. Um, so yeah, so goal setting I think is interesting field. We work also quite with intensive therapy. So we see that in my practice, we see the children, they come with their families and stay with us for 3 weeks. And we work 4 to 5 days a week, up to 5 hours a day. So it's very intensive. I really get to know them, and but we also see positive results. So yeah, I think that's interesting. I know that there's a lot of innovations within like more um like digital solutions and virtual reality. I'm not that into all the technology stuff. I prefer a bit more traditional, and I think that the communication with the patients, working together, working hands-on also, I think it's important. Um, so for the technology part, I don't have much experience in that, but I think we will see more of that in the future. Personally, I think we have enough screen time. So yeah, but I think that will some some children will prefer that kind of interventions compared to others. Yeah.
Yes. Well, Dr. Kina, my students are at the university are they're early childhood students. We have undergraduate students and graduate students, and some of them might want to specialize and go into pediatric physical therapy or physiotherapy. Do you have any suggestions or advice for a pathway into the field?
Um, I think it's good. Like you thinking of for clinical work or more research work?
That's a great point you bring up because there's so many different avenues you could take a lot of different ways to get into the field.
Yeah,
So
because I
yours
think
is
that
more research. Is yours more research with your postdoc?
I'm yeah. So now I'm doing research, but I have tried to work clinically all the time while I'm doing research. It's a bit of a difficult balance from time to time, but I think that's keeping my clinical experience fresh. That gives more. Um, I think makes my research more trustworthy because I really know what I'm doing research on. I know how it works in practice. I think it's important when I'm teaching that I have some practice. I always bring up some like clinical cases I can discuss or to give as examples. But I think I often tell students if they are considering working in the pediatric field, I think that it really gives you possibility to um, be creative and keep like uh, keeping a playful mind. I think that's really great. And also one of the best things about working with children is that you can really make a difference. There's so many things that are changing, all this development, so you make a huge impact. It doesn't say that you cannot make a change if you're working with the elderly population, but with children, I think yeah, there's lots of possibilities. So I would recommend for everyone to get some clinical experience before you go into research, because it's about also picking which specific field you want to study, to really go in depth with. Then it's good with some clinical experience. Yeah, and also just discussing with others who are in the field, like how did you get into it? What is the best part of it? Yeah, it's kind of to open some doors and see if this is something you would be interested in really specialize in, or not. Um, yeah.
Very, very exciting. And you just came back from Australia. Was the work you were
Yes.
doing in Australia similar to the work in Norway?
Yeah. So I had like a 2 month stay as a visiting researcher at the University of Wollongong in Australia, New South Wales. So I was working with some data from some I've collected in the postdoctoral the project I'm in, but also just yeah for networking and yeah getting getting new experiences. Um, but it really that is something I would recommend for everyone to have some time as an exchange student somewhere, because you really get so many inputs and also get time to focus. So I think I really had a productive period there for these 2 months. Yeah.
That's awesome. And my last question, Dr. Kina, is uh, when you think about your career, what's been the highlight or an exciting thing that's happened so far?
Yeah, I think that's a difficult question. I think when I had my PhD defense, uh, I was very proud of myself because I found it was a really challenging day. It's a great experience, but I was uh, I was like totally drained afterwards. But I felt really proud. I've been working hard for that degree, but I think it's a bit difficult to come up with like one specific uh, episode. I think there are what is more important is what small like magical moments that keeps you going and gives you like the feedback that's Kine, this is the right thing to do. This is why I'm doing it. Like it can be in my clinical work, it can be if I have a patient I've been working with for a while and he or she is really achieving a goal they've been working hard for it, or it could be I'm doing an assessment with this new measure that we are using, and I really see the joy the children show when they are doing this assessment. And I think that is so important because this measurement was developed really to be child friendly and playful. And then you see, yeah, it works. That's exactly how it was supposed to be. I think that gives me really like a reassurance of that we're doing something the right way. So I think that's really important to not always look on like the goals or the big uh, yeah um,
The
the
magical
big
moments.
events,
I
but
love that. The
magical
magical moments.
moments. Yes, I think that's and if you sometimes perhaps you have to look a bit for it because sometimes we take some things for granted, but and that's perhaps a good thing about working with children because they really show the excitement of really small things. So yeah.
Yes. Yes. Uh, that's awesome. Well, how can listeners follow more of your work and uh, be able to follow you?
Oh yeah. Um, well, I'm always excited to discuss uh, topics within this field with everyone. So people can contact me through email or social media. Follow me on social media. I'm not that active on social media, but yeah, I'm very happy if people will reach out to discuss ideas and stuff. Yeah.
Yes. And will you be speaking at any more conferences anytime soon?
Yes, I will. I will be at the World Physiotherapy Conference in Tokyo in May. Uh, I think I really want to go to the Bright Star Conference in November in London. Yeah, so that is what I have planned so far. Yeah, but it's really valuable to go to conferences and have presentations and meet people with other like from different backgrounds. I think that's also important. Me coming from physiotherapy into the early childhood education field, it's is really interesting. So yeah,
That's awesome. Well, thank you, Dr. Kina. It's great
yeah,
talking to you.
yeah. Thank you. You too.